Hello, my name is Marian. In today's video, I am going to go over everything that you need to know to pass your MRI registry exam. So since I do have my certification through ARRT, I am following their content specification for their exam, but you can use this to prepare for your ARRT and ARMRIT registry exam. This is used for both. The information that colleges and instructors use is the same information. It comes from the same book. But for this video, this is what I'm following. If you are with ART, could you comment down below and let me know if you're taking the ART test, or let me know if you're taking the ARMOR test. But if you are taking the ART test, you will have about 200 questions total on your registry exam. Is broken down into different sections. You have patient care, we have 16 questions, safety, 21 questions. You have image production, which will have 106 questions. So that's what we're going to focus on today. It's the physics. If you all could give the video a thumbs up, or let me know in the comment box if you want me to break down patient care and safety and also procedures, just let me know and I will make another video about that. And then for procedures, you'll have 57 questions. But if you look at the bottom, there is 30 unscored pilot questions that they will test you on, meaning questions that will not be scored, but depending on how many people get them right or wrong, they may or may not be asked in the future. All right, so for the video outline today, we are going to talk about instrumentation, which will cover your coils and gradients, the fundamentals, which is your overview, Lamar equation, etc., artifacts, motion artifact, flow artifacts, zipper artifacts, pulse sequences, trade-offs, which is increasing the TR does what, increases the field of view does what, spatial localization, imaging parameters, contrast. So for the basics of MRI, we're just going to keep it simple, just go over pretty much what you need to know. I also made a separate video about this. You can find it in my MRI Registry review playlist. I will link it to the end of the video. I also have a lot of practice test questions and answers that can help you as well. So we'll just keep it simple and just go over the basics of what you need to know. This is very important for you to know your elements for MRI. These are also found on the periodic table, if you remember this from chemistry class. So you have hydrogen, which will have a number 1. This is the most important element in MRI because its nucleus contains a single proton, which has a strong magnetic moment and is abundant in the human body for water and fat. So hydrogen is very important. And then you have 13 for carbon, 15 for nitrogen, 17 for oxygen, 19 for fluorine, 23 for sodium. Also know like carbon, C13, things like that. And then keep in mind about the hydrogen. Just know that for MRI. Okay, this is also important too. Your B0 is the main static magnetic field. Make sure that you know your B0 is the main static magnetic field. Also, your alignment, this is when the magnetic moments of the hydrogen nuclei are oriented in the same way as the main static magnetic field. Also, your net magnetic vector aligns in the same direction as the main magnetic vector. This happens during the longitudinal plane or z-axis. Like I was saying, I do have this section for MRI, the overview, broken down into a longer video for you to check out if you click on the MRI playlist. But we're just keeping it simple in this video, just letting you all know what you need to know. Now we're going to talk about the Lamar equation. Make sure you know the equation. If you don't know, the Lamar equation is the relationship between the precessional frequency of a nucleus and the magnetic field strength. It's important to have that Lamar equation memorize, know what W0 is, know what Y means, know what B0 is, which is W0 is the precessional or Lamar frequency, Y is the gyromagnetic ratio, B0 is the strength of the external magnetic field in Tesla or T. Know about Michael Faraday as well, the law of electromagnetic induction, which was made in 1833. His law states that a moving electric field produces a magnetic field. It's also a connection between electric and magnetic fields in motion. So his law is very important for you to know. His law also states that electromagnetic induction of a magnetic field is made by a moving particle that is going to be charged. And if I'm going too fast, you can always pause the video or rewind it. Now we'll have a Q&A just to test your knowledge. I will read the question, the answer choices, and then I will give you all the correct answer. Please give the video a thumbs up. Let me know down in the comment box if you want me to make a full Q&A video. I also have several in my playlist. So which of the following is the most important element in MRI and can be found on the periodic table? A, 13C, carbon, B, 19F, fluorine, C, 1H for hydrogen, or D, 17 for oxygen. Right, the correct answer is C, 1H for hydrogen, which is the most important element for us in MRI. The symbol for the main static magnetic field is A, B0, B, T, C, Y, choice D, W0. All right, the correct answer is A, B0, which is the symbol for main static magnetic in MRI. All right, so your vocabulary terms for each section and category is very important, especially make sure that you know these. The relaxation is when the hydrogen spins, loses their energy. You have free induction decay or FID. This is the loss of signal that is caused by relaxation. Also know your pulse sequences. We'll talk about that later on in the video, but this is a series of RF pulses. Your TR or repetition time is what is known as. It's the time between each excitation pulse. Your TE or echo time is the time from the application of a RL pulse to the peak of a signal that is induced within the coil. This is the time in milliseconds, also the decay of transverse magnetization. So now we'll just test your knowledge for that section. The time between each excitation pulse is called. All right, the correct answer is DTR. Also, you can go back and review the notes under TR, TE, FID, and the pulse sequence slide. Another question, spins lose their energy during A, pulse sequence, B, relaxation, C, TE, or D, TR. Okay, the correct answer is B, relaxation. All right, so if you are finding this video helpful, could you please like, share, and subscribe for more videos, and leave a comment down below letting me know if this video is helpful to you. Let me know if you want another video breaking down each topic, or if you want a full list of Q&A questions and answers. All right, so now we are going to just dive into the trade-offs you need to know. I'm telling you, you need to know this for your test. The more or most important terms that you need to know under this section, make sure that you do know the difference between resolution and contrast, because these two terms are easily confused for most people. So I would just make sure that you know all of these terms, but especially the difference between resolution and contrast. So resolution is the ability to distinguish between small objects or structures within the body. Contrast is used to enhance the visibility of specific tissues or structures, making them stand out more clearly in the images. That is why we use gadolinium. The facility I work at, we use Doterum, but it's also another contrast I've used, like Clariscan or something. So you can use, this is what we use to like enhance the visibility of things like your tumors, your infections, um, to rule out, cancer, rule out a tumor as benign or malignant, different changes, inflammation, things like that. And then contrast also shows the differences in SNR that is between two adjacent areas. You also have your matrix. This is a grid of pixels or voxels that represents the image. The matrix size is 512 by 512, which will give you a higher spatial resolution. And then you have a smaller matrix size, 128 by 128, which will give you a lower resolution and shorter scan time. Also, know your voxel. This is a three-dimensional area in the patient within the tissue that is being scanned. It does give poor SNR if it has a small voxel. And then for your pixel, this is the smallest sample 2D element in an image. All right, so for your trade-offs, you will probably have to pause this video to study this, because you do need to know it for your test, but I don't want to confuse you all by reading each line row by row and you all get confused. So just make sure that you know all of your trade-offs, know what happens when you increase TR, or what happens when you decrease TR, what happens when you increase your field of view, what happens, what do you need to change in order to like avoid motion or wrap in your image. And then this is like more information that you need to know about your trade-offs. Just pause the video because it can probably get confusing if I'm reading this like line by line for you all. So you'll just have to pause it to know this. Then I do have more trade-offs for you to know. Trade-offs is probably going to be like one of the most important areas of your test. This is just something that you do need to know, and it's also good as far as scanning. And then this is more trade-offs. And then more trade-offs right here. Like I was saying, just pause the video and then you can study, rewind as many times as you need to. All right, so another question for you. The ability to distinguish between small objects or structures within the body is called, is it A, contrast, B, pixel, C, resolution, or D, voxel? All right, the correct answer is C, resolution. The smallest sample 2D element in an image is called A, contrast, B, pixel, C, resolution, or D, voxel. Okay, the correct answer is B, pixel. Another question for you. An increase in parameter slices will A, decrease scan time, B, decrease the full body SAR, C, increase T1 contrast, or D, increase scan time. Okay, the correct answer is D, increase scan time. A decrease in the parameter slices will decrease the scan time. An increase in scan time can increase the SAR, body heating, because the longer the patient is in the MRI scan or scanner, the more chance or they'll have, to heat up. And if they do start heating up when the SAR is going up, I normally just take off some blankets or I turn the fan up to help with that. And then me on a Siemens scanner, I'm able to decrease the flip angle to help with the SARing. All right, so I have a question for you. When you are taking your registry, just let me know down in the comment box. Are you looking to work in a hospital or outpatient clinic setting? I have a lot of videos in my playlist. I need to link it at the end of the video where I tell you all about how to study for your MRI test, go over like things that I did to pass mine on the first try because I'm licensed in 5 other radiology modalities: X-ray, CT, MRI, mammography, breast ultrasound with ARRT, and I passed all of mine on the first try. Also, let me know which area of the test that is going to confuse you the most or you need most help in. Is it physics? Is it anatomy? Or is it patient care / patient safety? All right, so now we are going to talk about artifacts. Artifacts is another important area on your test where you should know the terms, like the definition, what artifact is it, how to fix it, what is it caused by, also know how it looks on the image. So know the artifact and the causes of them, like I was saying. If you do not know, an artifact is a feature appearing in the image that is not actually present in the object being scanned. So for instance, um, you may be scanning a brain MRI, but a patient has braces. The braces is not necessarily in their brain, it's in their teeth, but the metal from the braces is causing the artifact to go towards their brain images. So that is like an example of an artifact. So you have phase mismapping, Aliasing, chemical shift artifact, out of phase signal cancellation, magnetic susceptibility artifact, truncation artifact, cross excitation / cross-talk artifact, zipper artifact, shading artifact, Moore artifact, magic angle, equipment faults, flow artifacts, flow dependent, non-contrast enhanced angiography artifact, phase contrast MRA, black blood imaging artifact. So I made a separate video about artifacts. It's a Q&A video. You all can find that in the MRI Registry review playlist that I am going to link at the end of the video. You can use that video to help study your artifacts. Also, if you want me to make a separate video other than this one where I'm breaking down the artifacts, the causes, how to reduce it, let me know in the comment box and I can make a separate video about those. For your phase mismapping artifact, this is also known as ghosting artifact. It is produced as a moving anatomy artifact across the phase encoding axis that is in the image. The way you can fix this is to change the phase and frequency direction while scanning. Also, phase oversampling. Well, we'll get to that in just a second. But you have your respiratory artifact. This is caused by breathing. So whenever a patient is having their abdomen scan or their chest scan, if they're not following the breathing instructions correctly, this can cause the artifact, or just because of peristalsis as well can cause the artifact, which is just natural movement from our body that is not caused by us. It can be caused by our organs. For your respiratory artifact, use cardiac gating technique to help reduce it. Also, you can put an MRI strap across the abdomen body coil. Also, give proper breathing instructions to the patient. Let them know how long they will have to hold their breath for. The machine will let them know when to blow it out. Also, this artifact is seen on abdomen and chest scans. Also, if someone is having like an MRI neck done, like a soft tissue neck or a cervical spine, it's important to tell them like not to chew gum or swallow, because when they are swallowing something, it's going to move like their neck. So just let them know that. Also, your aliasing artifact, this is also known as wrap artifact. The anatomy is outside of the field of view for this artifact, and it is folded on top of the anatomy that is within the image. I normally see this on feet, abdomen, and brain MRI scans. What normally helps me get rid of this is increasing the field of view and your phase oversampling to fix this. So this is what I was trying to tell you a few seconds ago. The phase oversampling is a terminology that I have seen on the Siemens scanner. I have worked on Hitachi and GE, but I mainly use Siemens, so I'm not sure if they use the same terminology as oversampling. So just let me know in the comment box if you have seen this wording before. Also, let me know what type of MRI scanner are you working on. Is it Siemens, Toshiba, GE, Hitachi, Philips? What scanner are you working on? Then you have your metal artifacts. What are the causes of metal artifacts? Know how to eliminate them when possible. So you have braces, dental fillings. You cannot get rid of these, especially dental fillings. But for the braces, if the radiologist tell you to, or if the patient like can reschedule, is best if they can if it's like very important and they really need to see something, then they may have to reschedule whenever their braces are taken off, because it will cause a artifact like in their neck or in their brain area. But I have seen doctors who order the scan and they want it done, and the patient do not wait until the braces are removed. So just put in the notes, doctor really wants MRI scan, or patient really wants MRI scan, patient has braces, something like that. And then you can get rid of these artifacts the best way you can, if you can, by adjusting desaturation or sat band to avoid some of the artifacts, especially like from the braces. Also, you have surgical / metal plates and or rise like in your knee, in your back, hips, neck. A lot of times patients have told me that it's made out of titanium. That's what their doctor has told them. Also, you have your hair clip artifacts. I don't know why someone will let a patient come in a room with hair clips, but I know it happens where you get in a rush and you forget. But make sure that you are removing those hair clips, because it can cause an artifact. Also, what causes RF leakage artifacts, which is also known as your zipper artifact. So up until this point, do you all have any questions for me to answer? Let me know in the comment box. Also, if you could, let me know when you all have passed your registry. Feel free to give the video a thumbs up if you do not mind. Now we're going to dive into pulse sequences. For pulse sequences, make sure you know the sequence. Also know the graph or the chart that goes with each sequence, because it's very important. Okay, so what are pulse sequences? Pulse sequences are a specific pattern of radio frequency or RF pulses that is applied to the patient within the magnetic field gradients. It is used to determine how the MRI image is made by using the body's protons. This controls the contrast and the quality of the MRI images. So it's different tissues that are seen with different signals that is based on whether or not they are T1 and T2 relaxation times. Common types of pulse sequences that you need to know. Your T1 weighted, this is the differences in tissue relaxation times, also known as T1. Your fat will appear bright and fluid will appear dark. So keep that in mind. For T1 weighted images, fat will appear bright and fluid will appear dark. For your T2 weighted images, this is the difference in tissue relaxation times. For T2, your fluid will appear bright and most tissues will relatively appear dark. Make sure you know that. For proton density weighted, this is an image closer to the actual proton density of tissues that is provided. Your fluid attenuated inversion recovery or FLAIR, it will suppress the signal from the CSF. Very useful for visualizing brain lesions. That is also important. So I'm just throwing out an example. If you was asked a question on your test, which pulse sequence is very useful for visualizing brain lesions, and they give you different choices. Your answer that you would choose would be FLAIR because this is going to suppress the signal from the cerebrospinal fluid CSF. Also, is good at visualizing your brain lesions. Also, for your FLAIR, I forgot to mention that that is very important for your seizures. So if someone's coming in to rule out a seizure, make sure that the FLAIR sequence is ran. So for your STIR, this is going to suppress fast signals to visualize abnormalities in the tissues. It's useful for detection for a variety of conditions such as your MSK injuries, your bone marrow pathology, edema and inflammation, spinal pathology, tumors and masses. It's also short inversion times and inversion pulses that are used to create a high contrast between fat and other structures within the body. Your diffusion weighted imaging or DWI, this is the measurement of the movement of water molecules. This can detect areas where tissues are damaged. This is a very important sequence that we have to run whenever you are checking for a brain stroke. So make sure that you know that. This is an example of your T1 axial image and your T2 axial image. If you was asked this on the test, I would know how a T1 image will look, whether it's for a brain, foot, lumbar spine, C-spine. I would know how a T2 axial image will look. For your FLAIR images, this is the area within the brain that is highly important because it detects abnormalities within the brain tissues. It shows MS or multiple sclerosis well by suppressing the signal from the CSF. This allows pathology that is closer to the ventricles to be visualized better. Like I was saying, FLAIR brain images are useful for multiple sclerosis, your strokes, brain tumors, encephalitis, also your seizures. And then this is an axial image of FLAIR. Your spin echo pulse sequence, like I was saying, make sure that you know the graph forward, also know short TE and single spin echo. That's very important. So for your spin echo, this is going to use a 90-degree RF pulse to flip the net magnetization vector. So as you can see, it start with a 90-degree and then it has a 180 and then you jump a line and it has a 90-degree again. This pulse sequence is used to create T1 weighted images. Spin echo pulse sequences uses a short TR and a short TE. is highlighted. That's very important for you to know. It can produce T1, T2, and proton density weighted images. Your pulse sequences will start with a 90-degree RF pulse, followed by a 180-degree RF pulse, and then 90-degree RF pulse again, like the graph. For your echo train, the easiest way to remember this is it uses a lot of 180-degree RF excitation pulses to create a lot of spin echoes. So when you're going to see 90-degree, it's going to be followed by a lot of 180-degree RF pulses. So that's the easiest way to remember that. So if you've seen a chart or a graph on the test and it started with 90 degree and it has a lot of 180 degrees, know that that's your echo train. Okay, so now we have the proton density weighted image. Your TR range will be greater than 1,000, or you'll see 3,000 on up. And then your TE range is less than 30, so it'll be about 10 to 20. Your flip angle is 90 degrees. For your proton density weighted images, remember long TR and short TE. So I do have a disclaimer. So these numbers may vary at your facility or within your facility's protocol. This is how a proton density image will look. So it almost look kind of like a grayish color. And then for your T2 images, like I was saying, the numbers are going to vary. So the TR will be greater than 2,000. The TE will be greater than 80. The flip angle will be at about 90 degrees. Your long TR and long TE will give you a T2 image. That is very important to know. For your T1 image, your TR will be less than 800. So a range for this will be 400 to 800. Your TE will be less than 30. Your flip angle will be 90 degrees. You'll have a short TR and a short TE for your T1 images. Now we have our benefits of your stir images in MRI. It's very useful in MSK because it can detect lesions or tumors that are found within the bone. You have your long TR and long TE that is used with your stir images. Also, your TR is greater than 4,000. Your TE is about 50. Now we have our benefits of the parameters. Your TR controls the amount of T1 recovery, and it will control the contrast for T1. Your TE controls the amount of T2 decay and will control the T2 contrast. All right, so we'll just talk briefly about instrumentation and what you need to know for this section. Know the function of the gradients. Know your coils, which is your surface coil, body coil, extremity coil, brain coil. Which one of these coils will give you the best SNR? Also, your shim system, RF system, magnetism, your magnet shielding, permanent magnets, superconducting magnets, cryogen, helium, your quench button. What is the quench button for? Why is it used? When do you supposed to use it? What would happen if you quench the magnet? So all of this, if you want me to break down each section or each sentence for you into a separate video on instrumentation, let me know down in the comment box and I can do that for you. So I have a question for you. Which magnet does not use electromagnets? A, ferromagnetic, B, paramagnetic, C, permanent magnets, or D, resistive electromagnets? All right, the correct answer is C, permanent magnets. All right, so I have a question for you. When are you taking your MRI registry? Are you looking to work in a hospital or outpatient clinic whenever you have passed? I know a lot of people may already be working in MRI and they're just trying to pass their registry. So I do have like a deadline that I always give people on when to take it. You can find that. I will link it at the end of the video for you to click on. All right, so that's it for this video. If you found it helpful, could you please like the video? Also leave a comment. You can leave a comment letting me know, hey, great video, this helped, or hey, you did a great job. Can you make those questions and answers, which I do have some that you can click in the video to get to. Also the playlist. Also, you can just let me know if you found this video helpful when you're taking your test. How long have you been in your MRI program? How long was it for? Are you with ARRT? Are you with ARMRIT? Did you do an online school? Did you do a school where you went in the classroom on campus? So just let me know. I'm looking forward to reading your comments. And thank you all so much for watching. Good luck on your registry. Bye.